Hey guys, this is Dr. Hub. Today we'll look at the synovial joints and its types. So before we go ahead, let's look at a synovial joint. So looking at some important labelings, we have the bone here and these are the articular cartilages. Then comes the presence of a lining of the synovial membrane. So this is the synovial membrane. On the outer hand, there is presence of the articulate capsule. Then the space in between, this was the joint cavity containing the synovial fluid. Now let's look in detail about some joints. So the joints here, there is the plain joint. So this is how the movement is as mentioned in the diagram. Then there is presence of the saddle joint. Then there is a hinge joint. Next, there is also the pivot joint, and there is a ball and socket joint. The ball and socket joint is referred to the shoulder, and the ellipsoid joint. So to begin with, we look at the plain joint. So what is special about the plain joint? So the plain joint is that the articular surface, it is almost flat. So it is almost flat. So how is the movement? The movement is that it is minimal sliding movement. So there is a minimal sliding movement which is present. So what are the examples here? So the examples include the intercarpal, there is also the intermetacarpal, there is also the carpometacarpal. So the exception here is except the first one. Then it also includes the intertarsal, the intermetatarsal as well as the tarsometatarsal. Next, there is also the presence of the joints between the articular process of the vertebra. So joints between the articular process. So you're looking at the joints between the articular process, and this is of the vertebra. Then the cricothyroid joint, writing it as CTJ, and the cricoarytenoid joint, the CAJ. Then there is also the presence of the superior tibiofibula, so STF. So the other examples, it includes the intercordal. There is the intercordal joint, that is, it involves the 5th to the 9th ribs. And there is also the costovertebral. There is presence of the costovertebral, and there is the costotransverse. This costovertebral, this costotransverse, as well as the acromioclavicular and the cordosternal, and except. So there is an exception, that is except the first joints. Now secondly, let's move on to the hinge variety. So under hinge, what do we have? So the hinge is the articulating surface is pulley shaped. So the articulating surface, it is pulley shaped. It is pulley shaped. And how is the movement of the hinge joint? So the movement here, it is uniaxial flexion and extension. So it is uniaxial, the flexion as well as the extension. So what are the examples of the hinge joint? The examples of the hinge joint, it includes the elbow, the ankle, and the interphalangeal joints. Interphalangeal joints. Next we move on to the pivot. So in terms of the pivot joint, what is the articulating surface? The articulating surface will be the central pivot. The central pivot, so that is nothing but the peg, surrounded by, so this is surrounded by the osteoligamentous ring. The osteoligamentous ring. Now let's look at the movement. So the movement in terms of the pivot will be the uniaxial rotation. So there is going to be the uniaxial rotation. So this uniaxial rotation, it includes the supination as well as the pronation. So there is presence of the supination as well as the pronation. So what are the examples of the pivot joint? The examples of the pivot joint, it includes the superior and inferior radioulnar joints. So it's superior and inferior radioulnar joints, and there is also the median atlantoaxial joint. So there is a median atlantoaxial joint. Then we move on to the condylar variety. So this condylar variety, it is the bicondylar. So what are the articulating surface here? It is the two convex condyles. So there is the two convex condyles. So they articulate. So the two convex condyles, it articulates, and articulation is with the concave or the flat surface on the other side. So it is with the concave or the flat surface. So it is with the concave or the flat surface on the other side. On the other side. Then what about the movement? The movement of the condylar, that is biaxial. So the movement of the condylar is going to be biaxial, and but predominantly one axis movement. So it is predominantly one axis movement. It is one axis movement. So what does it include? It includes the flexion as well as the extension. So it's flexion as well as the presence of the extension, and this is with a limited rotation. So this is with the presence of the limited rotation. So what are the examples of this condylar type of joints? So the condylar joint examples include, there is the presence of knee joint. So there is knee joint. There is also the TMJ, temporomandibular joint. Then we move on to the ellipsoid variety. So under the ellipsoid variety, the articulating surface is nothing but the oval convex surface. So it is an oval convex surface, and this is fitting into the elliptical concavity. So it fits into an elliptical concavity. So how is the movement in terms of the ellipsoid? So the movement will be the biaxial. So what is meant by biaxial? Biaxial includes the presence of flexion as well as the presence of the extension. There is also the presence of the abduction and the adduction, and there is the circumduction. There is circumduction as well. Then we move on to the examples. So here the examples, it includes the radiocarpal. So there is presence of the radiocarpal, that is the involvement of the wrist. Then comes the metacarpophalangeal joints. So metacarpophalangeal joints, we are writing it as the MCP. Then let's look at the saddle. So under the saddle joint, we need to know that what is the articulating surface. The articulating surface in the saddle joint is that each articulating surface has a concave and a convex region. So each articulating surface, they have a concave and a convex region. There is a concave and the convex region, and it fits on the, so there is a articulating surface as a concave and a convex region fitting the convex and the concave regions on the other surface. So it fits the concave and the convex on the other region. Convex on the other region. So it is on other region. So this was about the saddle joint. Now how is the movement of the saddle joint? The movement of the saddle joint is that it is biaxial. So what do you mean by biaxial? Biaxial means it is by two axes. So it involves the presence of two axes, and there is flexion as well as extension. There is abduction as well as adduction, and it is very limited coupled axial rotation. So there is very limited coupled axial rotation. So coupled axial rotation. So that is nothing but the conjunct rotation. So it is nothing but the conjunct rotation. Now let's look at the examples of the saddle joint. The saddle joint examples. This includes the first carpo-metacarpal joint. So it's the first carpo-metacarpal joint, that is the CMC, carpo-metacarpal joint, and this is of the thumb. Then comes the calcaneocuboid joints. So the calcaneocuboid joints as well as the presence of the incudo-malleolar joint. There is incudo-malleolar joint as well as a there is a sternoclavicular. There is sternoclavicular joint. Now let's move on to the last one, that is the ball and socket variety. So under the ball and socket variety, how is the articulating surface? The articulating surface, there is a globular head. So there is a globular head, and this fits into a cup shaped socket. So there is a cup shaped socket. So how is the movement here? The movement here is that it is multi-axial. It is multi-axial. That is presence of a flexion and extension. So there's flexion, there's extension. Then there is also the abduction and the adduction. Then there is the circumduction and the rotation. The circumduction as well as the rotation is present. Now, what will be the examples here? The examples here, it includes the shoulder. So there is the shoulder, there is a hip, the talocalcaneo-navicular joint. So it is in short known as a TCN, talocalcaneo-navicular. Then there is a incudostapedial joint. There is incudostapedial joint as well.